Did you know that nearly half of all adults over 60 will develop symptomatic knee arthritis in their lifetime? And here's what most people don't realize: surgery often isn't the only option, or even the best first option, for knee pain relief. I'm Maggie Wells, and today we're exploring 4 gentle exercises that physical therapists and orthopedic specialists recommend to reduce knee pain, improve mobility, and help you avoid or delay surgery. These aren't intense workouts. They're targeted movements designed to strengthen the muscles supporting your knee, reduce inflammation, and restore natural movement patterns. Before we begin, my important disclaimer. I'm not a medical doctor, and this video is for educational purposes only. If you have severe knee pain, sudden swelling, instability, or a recent injury, you must see a healthcare provider for proper diagnosis. Never ignore persistent or worsening pain. Always consult your physician before starting any exercise program. Now, let's discover how these 4 exercises can change your relationship with knee pain. Understanding why these exercises work requires understanding what's actually happening in your knee. For most people over 60 experiencing knee pain, the problem isn't just in the knee itself. It's in the supporting structures: weak quadriceps muscles, tight hamstrings, weak hip stabilizers, and poor movement patterns that put excessive stress on the knee joint. A groundbreaking study published in the Journal of the American Medical Association followed over 300 adults with knee osteoarthritis. Half received standard care, while half participated in a targeted exercise program. After 16 weeks, the exercise group showed pain reduction equal to or greater than those who underwent arthroscopic surgery, with benefits lasting over a year. Another study from the University of Melbourne found that strengthening exercises reduced knee pain by 43% and improved function by 40% in just 12 weeks. Remarkably, these improvements were maintained at 1-year follow-up, suggesting that exercise creates lasting changes, not just temporary relief. So why does exercise help when your knee already hurts? It seems counterintuitive. Here's the science. Strong muscles around your knee act like shock absorbers, reducing the load on your joint. Improved flexibility reduces abnormal stress on cartilage and ligaments. Regular movement pumps synovial fluid through your joint, nourishing cartilage and reducing stiffness. And consistent exercise reduces inflammation throughout your body, including in your knee. Now let's explore the 4 exercises. These should be done 3 to 4 times per week, with at least 1 rest day between sessions. Start with 1 set of each exercise, and gradually build to 2 or 3 sets as your strength improves. Exercise number 1: straight leg raises for quadriceps strength. This is the foundation exercise for knee pain relief. Your quadriceps, the large muscle on the front of your thigh, is crucial for knee stability. When it's weak, your knee joint bears excessive force with every step. Here's how to do it safely. Sit on the floor or your bed with your back supported against a wall or headboard. If sitting on the floor is difficult, you can do this on your bed. Extend one leg straight out in front of you. Bend your other knee with foot flat on the surface for support. Flex your foot, pulling your toes toward your shin. This activates your quadriceps. Now, keeping your leg completely straight, lift your heel about 6 inches off the surface. You should feel your thigh muscle working. Hold for 5 seconds at the top, then slowly lower. That's 1 repetition. Start with 10 repetitions on each leg. If this feels too difficult, lift your leg only 2 or 3 inches. The key is keeping your leg perfectly straight and your quadriceps engaged. If this is too easy, you can add a small ankle weight, starting with just 1 or 2 pounds. Here's the golden years secret about this exercise. Research from the Hospital for Special Surgery in New York found that consistent straight leg raises increased quadriceps strength by 35% in just 8 weeks. And here's the remarkable part: patients who strengthened their quadriceps by at least 20% reported 50% less knee pain during daily activities. The reason this works so powerfully is that your quadriceps controls how your kneecap tracks over your knee joint. When your quadriceps is weak, your kneecap can shift slightly out of alignment with each step, creating friction and pain. Strengthen that muscle, and your kneecap glides smoothly, dramatically reducing discomfort. Exercise number 2, hamstring curls for balanced leg strength. While quadriceps strength is crucial, you also need strong hamstrings, the muscles on the back of your thigh. These muscles work in opposition to your quadriceps, and imbalance between them can create knee problems. Here's how to do hamstring curls safely. Stand behind a sturdy chair, holding the back for balance. If your balance is uncertain, stand in a corner where you can touch two walls if needed. Shift your weight onto one leg. Bend your other knee, bringing your heel toward your buttocks. Lift as high as comfortable, but stop if you feel any knee pain. Hold for 2 seconds at the top, then slowly lower. That's 1 repetition. Start with 10 repetitions on each leg. The movement should be slow and controlled. If this feels too easy, you can add a light ankle weight, but start with just 1 pound. A study from the Journal of Orthopedic and Sports Physical Therapy found that balanced quadriceps and hamstring strength reduce knee pain more effectively than strengthening quadriceps alone. The hamstrings help stabilize your knee from behind and control the rate at which you straighten your leg, protecting your knee joint from sudden forces. Many people with knee pain have quadriceps that are much stronger than their hamstrings, creating an imbalance that stresses the knee. This exercise restores balance and protects your joint. Exercise number 3, mini squats for functional strength. Now we're combining the strength you've been building into a functional movement. Mini squats strengthen all the muscles around your knee while training the movement pattern you use dozens of times every day, sitting down, standing up, getting in and out of a car. Here's how to do mini squats safely. Stand facing a sturdy chair or counter, holding it lightly for balance. Position your feet hip-width apart, toes pointing slightly outward. Slowly bend your knees, lowering yourself about 4 to 6 inches. Think of it as starting to sit in a chair, but stopping halfway down. Keep your weight in your heels, not your toes. Your knees should track over your toes, not cave inward. Hold for 2 seconds, then slowly straighten back up. Start with 10 repetitions. If this creates knee pain, reduce the depth of your squat. Even a 2-inch bend provides benefit. Never squat so deep that your knee bends more than 90 degrees or you feel pain. Here's what makes this exercise so powerful. Research from the University of North Carolina found that mini squats activated not just the quadriceps and hamstrings, but also the hip stabilizers and core muscles. This comprehensive muscle activation created better overall leg strength and improved how people moved during daily activities. Participants who performed mini squats 3 times per week for 12 weeks reported 38% less knee pain when climbing stairs and 42% less pain when getting up from a chair. These are the exact movements that often limit independence, so improving them has profound quality of life benefits. The key with mini squats is never forcing through pain. If your knees hurt, reduce the depth or skip this exercise for now and focus on the first 2 exercises until you've built more strength. Exercise number 4, side leg raises for hip strength. This final exercise might surprise you because it doesn't seem to target your knee at all. But weak hip muscles, particularly your hip abductors on the outer hip, are a major contributor to knee pain. When your hip muscles are weak, your thigh bone rotates inward with each step, creating abnormal stress on your knee joint. Here's how to do side leg raises safely. Stand beside a sturdy chair or wall, using it for balance. Stand tall with good posture. Keeping your leg straight, lift it out to the side about 6 to 12 inches. Your toes should point forward, not up or out. Hold for 2 seconds at the top, then slowly lower. Start with 10 repetitions on each leg. The movement should be slow and controlled. If this is too difficult, reduce the height you lift. Even a 3-inch lift provides benefit. A remarkable study from the Journal of Bone and Joint Surgery followed 2 groups of people with knee osteoarthritis. One group did only knee-focused exercises. The other added hip strengthening. After 6 months, the hip plus knee group had 48% greater pain reduction and significantly better functional improvement. The researchers found that strengthening the hip muscles changed how force traveled through the leg. Instead of excessive inward rotation creating stress on the inner knee, the leg moved in better alignment, distributing force evenly across the joint. Many people are shocked to discover that their knee pain improves dramatically when they strengthen their hips. It's a perfect example of how the body works as an interconnected system, not isolated parts. Now let's talk about how to structure your exercise program for maximum benefit. Do these 4 exercises 3 to 4 times per week. More is not better. Your muscles need rest days to recover and strengthen. Start with 1 set of each exercise, which means 10 repetitions. As this becomes easier, over 2 to 3 weeks, increase to 2 sets. Eventually, you can progress to 3 sets, but this isn't necessary for everyone. The progression should be gradual. Add 1 repetition per week, or increase by 5 repetitions every 2 weeks. Listen to your body. Some soreness the next day is normal, especially when starting. But increased knee pain, swelling, or pain that lasts more than 2 days means you're doing too much. Apply ice to your knee for 15 minutes after exercising if you notice any swelling or increased warmth. This reduces inflammation and speeds recovery. Here's what you can realistically expect. In the first 2 weeks, you might notice your knee feels slightly better, particularly less stiffness in the morning. By 4 weeks, most people notice reduced pain during daily activities like walking and climbing stairs. By 8 to 12 weeks, significant improvements in pain, function, and confidence are common. A long-term study from Stanford University followed people who maintained a knee strengthening program for 1 year. 82% avoided surgery that had previously been recommended. 76% reported their knee pain was no longer limiting their daily activities. Some important safety considerations. If you have severe knee arthritis, a torn meniscus, ligament damage, or other diagnosed knee conditions, work with a physical therapist who can modify these exercises for your specific situation. If you experience sharp pain, immediate swelling, or your knee gives out or locks, stop and see a doctor. These could indicate a problem requiring medical attention. Consistency matters more than intensity. Doing these exercises 3 times per week for 8 weeks will provide far more benefit than doing them intensely for 2 weeks and then stopping. And remember, these exercises work best as part of an overall healthy lifestyle. Maintaining a healthy weight reduces stress on your knees. Even a 10-pound weight loss can reduce knee pain significantly. Staying active with low-impact activities like swimming or cycling on easy days keeps your knee mobile without excessive stress. If you found these knee pain relief exercises helpful, please subscribe to Golden Years Secrets. We share evidence-based health wisdom every Tuesday and Friday at 2 p.m. Eastern. Drop a comment below and tell me, how long have you been dealing with knee pain, and what activities do you miss most? I read and respond to every comment, and your experiences help other viewers realize they're not alone. And don't forget to like this video so more seniors can discover these surgery alternatives. Next time, I'll be revealing a 5-minute morning routine that can make you feel 20 years younger. It's simple, energizing, and you can do it before you even get out of bed. You won't want to miss it. Until then, I'm Maggie Wells reminding you that your body has remarkable healing abilities when you give it the right support. Keep moving, stay strong, and I'll see you next time.